Thank you, Mr. Chairman. I so appreciate this hearing. I happen to think it's very timely, and I am not one that thinks that we are beyond this pandemic. We are in the midst of it, but even while we are in the midst of an active pandemic, it is important to not only understand where we've been, but where we are going. And Governor Leavitt, I really appreciate the comment that you made in 2007 while serving as secretary, and you've repeated some of it in your opening testimony here. Everything we do before a pandemic will seem alarmist. Everything we do after a pandemic will seem inadequate. This is the dilemma we face, but it shouldn't stop us from doing what we can to prepare, and prepare every day for what we really don't know. So back home in Alaska, we have heard from our state officials and just from Alaskans around the state, what are the priorities as we're dealing with the here and now? It is still supplies and manufacturing, still making sure that we have what it is that we need. Testing capacity continues to be a challenge, but we've been aggressive with that, which I credit our state teams with, but worrying about supplies. Consistent messaging, no different in Alaska than what we're seeing around the country. Levels of confusion, though, when you're having mitigation strategies that are perhaps conflicting, that cause an issue of distrust from the public, and we need to pay attention to that. But the one that I want to speak to and ask questions about is the public health IT infrastructure. Our state reports that IT infrastructure for contact tracing still lacking. What we're using is Excel spreadsheets and faxes as our main tool for their contact tracing efforts. We have 761 cases as of this morning. Over 250 of those are active. Our teams have been working and staying on top of it, but the article in the newspaper just yesterday is we're close to being maxed out. So as we're thinking about that and recognizing that there are several proposals out there for a national contact tracing, TTSI, the contact tracing, diagnostic testing, supported isolation, and the need to suppress or mitigate. So the question that I would have is whether or not we need to have a national contact tracing program, or do you believe that we can focus our attention on bolstering the funding and the capacity of public health departments at the state and locality level? Because as I talk to Alaskans, they're saying, we think we have this, we want the support, financial support, but we don't know that we want a national program. So I guess I would ask you, Dr. Frist, and you, Governor Leavitt, for your views on that role with contact tracing, because I think going forward, this is going to be a key aspect to how we can stay on top of what we're dealing with. Your thoughts?
Yeah, thank you. And just to preface what I'm saying, I think our second pandemic may come in about 3 months. And that's why I do think it's important to do exactly what we're doing. Learn very quickly and apply what we can right now. And then an after-action review will, I'm sure, occur next year or 2 years or 3 years. On the contact tracing workforce, there have been a whole bunch of estimates out there as to what is needed. We know it is the most effective action at this standpoint. And the workforce does operate under state and local management, even if it's a federal program, and it needs to expand to help control COVID-19. We have to. All of these studies have concluded that we got to expand. It's about 180,000 people that are needed. Can states do that? Probably not, because states have had their public health infrastructure underfunded at the state and local level. A lot of them don't even have epidemiologists in the local communities, much less contact tracers. And so I think we have to go out for federal support this time around, maybe not next time around, until we have an effective vaccine that's on the market. If we see new cases, we're going to have to increase it. Massachusetts has done a great job. It hired and trained applicants quickly, gotten them out there. So Dr. Gottlieb and I and Andy Slavitt have proposed for this pandemic a federal workforce, federally funded, and then allocation of that funding to the state so they can get it up and running today. And we have that on record and have proposed that.
Thank you. Thank you, Dr. Pierce.
Senator, I believe that a national strategy is required. It will require some local execution. Let me be deliberate about that. Clearly, we will need to have national funding to support this in the way that Senator Frist has articulated. Secondly, there has to be a national system that local input feeds into, where standards are used in how data is collected so it can be rolled up quickly. So there are components of local execution that are required, but there's a clear need for national funding on this pandemic. As I agree with Senator Frist, public health has been malnourished over the course of the last almost 40 years, and we need to build up that infrastructure. So we can have a national system, but it will require some execution by the local level, but ought to be done according to a set of national standards.